It's decision time for seniors and their Medicare coverage. Open enrollment is underway through December 7th, and that's why it's important not to put off deciding on your Medicare coverage. Here to help you make the right decision, today's CI Health sponsor, Complete. We have Jonathan Davis hanging out with us. Welcome.
Well, thank you.
Okay, so first, let's get it all figured out here. There's a lot of information. It can become a little overwhelming. So let's just kind of get started with whether you need Medicare or Medicare Advantage, what the differences are.
Well, there's two distinct differences between Medicare, original Medicare, and Medicare Advantage. First of all, original Medicare, you have that Part A, which is your hospital coverage. You have Part B, which is your physician coverage. And then you're probably going to add in that prescription drug coverage as well. Now, with original Medicare, it doesn't include things like, vision coverage or hearing coverage or help with things like that. If you go over to the Medicare Advantage side, it kind of rolls all that into one for you, one package. Kind of like when you were, before someone retired, the kind of health plan they had. And it just works great that way because it also includes things like routine vision, dental, and hearing services.
Now, it's saying their monthly premiums with some plans start at $0?
Yeah, exactly. Most people can't get away from paying that Part B premium per month. Everybody pays that. But with the Complete Advantage plan, there's no additional cost. A lot of them have no additional cost or no monthly premiums. There are plans that do, but those Complete plans start at $0 cost.
Okay, so let's talk about why someone would and should pick a Complete plan.
Well, a Complete plan is nice because it kind of streamlines things for everybody. It's one of those things that, the health insurance agency got together with the providers, and they created a plan that works well for individuals.
Okay, so here are some of the reasons why also that you may choose a Complete plan. Oh, sorry, I was not paying attention. Can you put those back up? Thank you. A more complete healthcare experience, like you mentioned. Being able to pick your own provider.
Yeah, so even though a Complete plan is a Medicare Advantage plan, which is a HMO plan, has a provider network, it works well with a lot of the providers that you already work with. So they're usually included in the network. And then the monthly premiums, the monthly costs, are a lot lower usually than original Medicare, and even when you go to the doctor, the lower cost too.
Okay, now again, me not being the expert on Medicare, so there is a difference between Medicare, Medicare Advantage, and the Complete plan?
A Complete plan is a Medicare Advantage plan.
Okay, okay. That's good to know. So what about, I know you mentioned the dental and the vision. What about the fitness? I know there's a lot of, I remember we've talked about this before with other times that you've come on to talk about Medicare and all that. That could also be streamlined and rolled in, yes?
Yeah, so with as a BFit perk or BFit fitness plan, which basically, if you remember last year, helped you reimburse for a gym membership. They've expanded that this year, which is great, to other services. So like if you like to play golf, your membership will help you cover the cost for golf.
Wow.
So like the bowl will cover the cost for that, pickleball, things like those things. You want to do a 5K or 10K. The goal is to keep people healthy.
Well, yeah, and then they may not need to go to the doctor as much, which is always a bonus. All right, what's coming for 2022?
So like we mentioned, those BFit benefits there that have expanded, but the dental benefit has also expanded tremendously. So again, something that's not offered with original Medicare, but with the Complete plan it's offered. It's also offer the extended with the prescription plans as well. Okay,
now it is open right now.
Yep.
So they have until December 7th.
Correct, October 15th to December 7th every year.
And I'm going to guess there are going to be people out there who wait until December 6th to say, you know what, I might have to make a decision now here on my Medicare and Medicare Advantage.
Right.
So probably best not to wait and get in touch with you all.
Yeah, you don't want to wait to the very last minute. As long as we have an application in hand by December 7th, we're good to go. But imagine a lot of people running things in at one time is kind of crazy.
Yeah, well, and I'm sure there's people out there who are helping make decisions for family members, and there's a lot to figure out. So if you have questions, maybe you want to learn a little bit more, there's the number on the screen as well as the website. And we will have all of that on our website, CILiving.tv. And a big thanks to Carl for sponsoring today's CI Health segment. Jonathan, thank you so much.
Thank you so much.